Hi, and welcome to Mindful, Beautiful, and Thriving, a podcast series by Thakkar Foundation focused on youth mental health. Before we begin today's episode, I just wanted to let you all know that all content that is found in our podcast is created for informational purposes only. This content is not intended to be a substitute for professional medical advice, diagnosis, treatment, or therapy. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition, and never disregard professional medical advice or delay in seeking it because of something you have heard in this podcast. Thank you so much, and without further ado, let's get started.
Hi, everyone. Welcome to Mindful, Beautiful, and Thriving, a podcast series focused on youth mental health by the Thakkar Foundation. Today, we are going to be interviewing Dr. Smita Thakkar, a child psychiatrist. We will ask her about how she treats anxiety and how the medication helps.
Welcome, Dr. Thakkar. Would you like to introduce yourself?
Sure. Thank you very much, Krupa and Sanya, for interviewing me. My name is Smita Thakkar, and I'm a child psychiatrist. I work at Bay Area Clinical Association for last 8 years, and also work at Comprehensive Psychiatric Services for last 10 years.
Thank you for the introduction. So first off, when do you recommend that a child's anxiety needs to be treated with medication in terms of age and also severity?
Sure. So whenever we see a kid with anxiety, first we try to figure out what is the cause of anxiety and what's going on. After we come to make a diagnosis of anxiety, we try to see how severe the anxiety is and how it is affecting their functioning. In sense of if they are unable to go to school, they are unable to see their friends, those are considered severe anxiety. If they just have some anxiety which is affecting their sleep or appetite, those are considered mild anxiety. And in between, anything is considered moderate anxiety. So the first treatment we normally go ahead and ask them to do is mindfulness, exercise, get some therapy. And if they have tried all these things and they're still not doing better, then we will consider medications. Age is not a normal factor for anxiety. We normally try to treat anybody, try to avoid anybody above the age of 6 years of age. We try to avoid medications lesser than that because most of the time kids do very well with young age less than 6 years. Anybody who has anything moderate to severe anxiety, we would recommend medications for them.
Yeah, that definitely makes a lot of sense. I like how you talked about how age is not really a deciding factor because, anxiety doesn't really discriminate based on age, right? And I've seen a lot of people with anxiety that see therapists and take medication, but I've never really understood how medication can really help the anxiety. So, can you explain what they do and why, in some cases, just going to a therapist just isn't enough?
Sure. So our normal human body builds up some hormone called as serotonin. There's a neurotransmitter which is available in your system on regular basis. But if somebody is on constant stress or constant worries or trauma that's been going on, this neurotransmitter does not meet the demands of our body. And that is the time when we really need us to try to balance the serotonin in our body. To balance the serotonin in our body, we may consider medications. And basically, we are not putting anything in your body. We are basically helping to increase the serotonin in your body, which has already been produced by your body. So the serotonin is basically the neurotransmitter that really helps to work with our stress hormones and work through our stress during this period of time. To help, especially in a moderate and severe cases, the situation is you've been under the stress for a long period of time, hence the demand is getting increased and your body is not able to produce that. So this medication will help the body to produce more serotonin and that will help with the anxiety. And that's the reason why sometimes therapy doesn't help.
Wow, thanks so much for explaining that to us. I really didn't know anything about how it works before, and I'm glad that you're here to kind of explain how it works. So based off of the disorder and then also the severity that you were talking about, are there different medications that your patients would take?
Yes, there are multiple medications in the market. The number one medications which we normally start out with is called as a selective serotonin reuptake inhibitor, which is also called as SSRI medications. Most of us have talked about or heard about the names like Prozac or Zoloft, and those are from the same family that these medications belong to. So SSRI medications, basically we avoid their reuptake by the body, and that's the way we increase the serotonin in the brain. And we use those medications to help with the balancing of the serotonin in the system when somebody is going through the anxiety. There is also another class of medication called as SNRI, which is called as serotonin norepinephrine reuptake inhibitors. They work basically on serotonin and norepinephrine neurotransmitters, and they also help with anxiety when we don't do very well with the SSRI medications.
Yeah, that definitely makes a lot of sense. So thank you for explaining to us like the two different types and what like they're kind of used for and what they do. And I know that it's common for adults to take medications daily, but are they safe for children and teens to take daily?
So there are a lot of research done in last 20 to 30 years, and they have found that some of these medications are safe for children and teenagers to take them regularly. There are some side effects that we have to monitor, and we normally explain the teenagers what type of side effects would that be, and that way we can monitor them regularly and work through them. But evidence in the research has shown that it has been safe to use it for teens and children too.
That's good to know. I'm glad that it's pretty safe for kids and teens, especially since I've seen so many who struggle with anxiety. So once one of your patients starts taking medication for anxiety regularly, how long do they need for it to show results, and when do they usually stop?
Most of the time, when you start the medication, we tell patients and parents the medication is not to cure the anxiety completely, but to take the edge off so that you can use your coping skills for your anxiety. Normally, it will take about 4 to 6 weeks to start working. So, the first 2 weeks, normally you see side effects of the medication, and we want to monitor all the side effects during that period of time. And about 6 to 8 weeks, you start seeing the response, and a lot of kids will start talking about that they can fall asleep better, they are not feeling always on the edge, they are able to focus on their school, and that will help us to understand they are doing better. Once we start the medication, we want to continue the course of the medication for about 9 months to 1 year. And the reason to continue the medication for such a long period of time is so that during this period of time, the child can learn coping skills and able to use the coping skills. And then we start decreasing the medication, and sometimes we do stop the medications, and they do really good with stopping the medication.
Wow, that's really interesting. Really, I didn't know that it took such a long time to be on the medication to really like not just like see results, but like be able to learn those coping skills and kind of wean off of it as well. So is it possible for the medications to sometimes not work in some cases? And if that were to happen, what exactly would you do?
So we normally recommend patients to do medication and their therapy, and also use some mindfulness and exercise, and do all those together, because that gives the best results. Yes, there are times when the first medication we may try that may not work. So then we may try the other family, like SNRI family that we talked about, and we may consider those medications with those families. And if that works out, and most of the time we see about sometimes we need to give about 2 or 3 medication trials to see if the medications are working or not. Most of the time, people will recommend that the medication does help them, and they really do well when we use the combination of medication and therapy together.
I'm so glad that there are also other options, like other than medication, if it's not working. And I'm glad that there's like definitely backup plans just in case, because I've really only heard about like therapy and then medication and really not much else. I've also heard that a lot of people use like a combination of both of them to get a lot better. So how does this work, and how do they kind of work together?
So medication helps to take the edge off of your anxiety when you're having severe anxiety, and then you're also learning in your therapy different coping skills of how to keep yourself calm when you're feeling anxious. And both of this works in the senses you use your deep breathing exercises, you use some mindfulness techniques, you go out for exercise. Those are all those things together will help them to decrease the demand in your body for serotonin, which helps the decrease in anxiety, which helps your anxiety better whenever it happens.
Yeah, that definitely makes a lot of sense. I think it's really cool actually how therapists and psychiatrists like work together in order to make this one patient so much better in like not even that long of a time frame. So thank you so much for joining us today for this interview. It was very insightful, and I learned a lot about how you can treat anxiety with medication. So thank you.
Thank you very much for having me, and thanks for taking this time to learn about anxiety.
Okay, thanks again, and we'll see our listeners next week.
Awesome.
You are listening to Mindful, Beautiful, and Thriving, a podcast series by Tharaka Foundation. As part of our youth series, we will be releasing new episodes every weekend, so make sure to continue to check those out. We hope you enjoyed this podcast, and thank you so much for listening.